What is your assessment of US preparedness for this?
I think things are really ramping up. I'm pleased that diagnostic capacity in the United States has expanded this week and will continue to expand in the coming days. I do think that will mean that we will identify more cases in the United States, which might feel alarming, but it's really us just catching up to the current situation and getting a better understanding of that epidemiological situation.
Are enough tests available?
Yes, they are coming online. About half of state and local public health testing laboratories now have capacity to test, and I understand the rest of them will be coming online this week. That will bring us to about 10,000 tests a day if things run smoothly, which I expect to be enough.
Dr. Rivers, tests have not been available, and we're looking at cases going back 2-3 weeks here in the United States. What's your best guess? How many Americans do you think actually are infected by this virus that we don't know about?
It's impossible to say, and that's why it is so important that we have testing capacity. And that's why I think we will see more cases in the coming days and weeks because there has been transmission likely happening that we haven't observed. And so we're going to go out and find those cases now and get a better handle on the situation. But there's no way to really estimate what the current status is.
We're also hearing conflicting messaging from the White House, from the Vice President, from disease experts about just how high the risk level is here. What is your long-term outlook for just how serious this is and how many lives it could claim?
I think the current risk to the average individual is low. For communities that are seeing transmission, I think that the state and local public health departments for those jurisdictions are communicating about the risk, what the risk will be. I do think there is reason right now for the general public to take steps to reduce their own personal risk, regardless of what they're seeing in the community. And the best ways to do that are hand hygiene and respiratory etiquette, which is covering your cough and staying home if you're sick.
Dr. Rivers, I asked this question to a number of guests because you see a lot of people walking around with face masks on. Are they actually effective?
They are effective if sick people wear them to contain their coughs and sneezes and so on. They are not particularly effective for well people to stay well. We are also concerned about supply chains and making sure that healthcare workers have access to those masks because they're at high risk being in contact with people who may be sick. And so we want to make sure that they have access to the supplies that they need to be healthy.
For those of us who aren't in the United States, I've got to be honest with you, the US health system is a subject of intense fascination for us all. Is there a risk that people who are not well will not come forward because they don't have insurance?
That might be a risk, and it could be a risk anywhere because it's difficult to kind of understand what to expect when you go to the doctor. Some people have anxiety about that. And certainly underinsurance or lacking insurance in the United States could compound those concerns. And so I do worry about that. We have a social safety net in the United States to some extent that helps to cover those people and make sure that they can access the resources that they need. But I hope that there's additional consideration about how to make sure they're cared for.
Meantime, we're hearing that treatment in the U.S. will be available towards the end of the summer, but a vaccine we're looking at the end of this year, maybe early next year. Is it your assessment that this just becomes like a strain of the flu that we are vaccinated against every year, but we have this risk period of a year almost until we have that vaccination?
We're only 8 weeks into this brand new pathogen, and so it's really difficult to understand the long-term horizon of what we could expect to see. I think it's true that we likely will not have a vaccine this calendar year, and so I think we should proceed with that planning assumption.